You're watching TVC News. Nigerian Civil Aviation Authority has warned airlines about airlifting passengers suspected of having Ebola disease, while the warning is coming after the resurgence of the disease in the Democratic Republic of Congo. The Federal Airport Authority of Nigeria has allayed fears of possible spread of the Ebola virus into the country. Mark reports.
International passengers at the point of entry, Murtala Mohammed Airport, Lagos. Unknown to the travelers, their health status is profiled thanks to the thermal scanners. This is part of the lessons learned from the previous outbreak of Ebola. According to experts, the equipment is an important step to the detection of infectious diseases such as Ebola, which symptoms include high fever, body aches, headache, and vomiting. Federal Airports Authority of Nigeria says it's prepared to stem the spread of Ebola into the country. The agency is partnering Port Health in leading the country's surveillance and defense on infectious diseases.
Every arriving passenger, you walk past these thermal scanners. As you do, it captures your temperature. If your temperature is high, it triggers an alarm, and then you're pulled aside for further screening.
Between 2014 to 2016, the World Health Organization declared a global emergency on Ebola in West Africa, which killed about 11,000 people. The new declaration calls for alertness to check the spread. But this time, the Nigeria Airports Authority has adopted a new approach.
If you remember, about 6 weeks ago, there was a passenger that came into the country that was suspected to have come with Ebola. Immediately, the thermal scanner captured it and the temperature was high. He was pulled aside and he was taken to the infectious diseases hospital in Yaba. Further checks were carried out on him and they all turned out negative.
Air travelers seek special attention paid to passengers from Ebola endemic countries when they arrive Nigeria.
Those countries surrounding, having boundaries with DR Congo should be the priority of the port health officials here when they are screening. Secondly, the airlines that come from these countries that are having boundaries with DR Congo, the moment they land, let it be the priority of the official at the Murtala Mohammed Airport to screen them very well before they come into our country so that they don't import Ebola here the second time.
I wish to commend the Federal Airport Authority of Nigeria. Since about 2 years ago, when that outbreak, the first outbreak that came to Nigeria happened, they have been alert, they have been preemptive, and they have kept their systems.
Importation of infectious diseases into any country is dependent on how porous or secure the borders are. Gatekeepers at Nigeria's airports are expected to keep updating passenger profiling equipment for easy detection of such infectious diseases before it ravages the country. The World Health Organization issues the global Ebola warning after spread to a big Congo city. In Democratic Republic of Congo, statistics from the Ministry of Health show that the total cases stand at 2,522. 2,428 cases have been confirmed, while 374 are under investigation and 1,604 confirmed deaths. The World Body says the declaration of the global emergency could lead to better funding and possible creation of a new United Nations body to coordinate international responses. Lilian Ezemak, TVC News, Lagos.